Hello, everyone. Thank you for joining and thank you for your patience. So we're going to start. Thank you again for joining today's session on the certificate in conflict medicine that is offered by the Global Health Institute at the American University of Beirut. Before we dive into today's discussion, I'd like to introduce our team. We have with us Ms. Dalia Sreiddin, who is the project coordinator in the Academy Division, the GHI Capacity Building Arm. We have with us Ms. Tracy Doe, and she is the Conflict Medicine Program Manager. And I'm Nasreen Al-Hadi. I am the Academy Division Manager. Again, thank you for joining. And today's session is going to build on our advocacy efforts to integrate conflict-related trainings within healthcare education. So over the past 2 months, GHI hosted two major events. So the first one was on integrating conflict medicine into medical education. And the second expanded the discussion further to include other healthcare professionals, such as pharmacists, nurses, psychologists, physiotherapists, and allied health professionals, among others. So starting in with an overview about the Global Health Institute, we operate in three main divisions. So the first division is our programs division, and that is our research and policy arm. As you can see, this is where the certificate in conflict medicine is housed. The second division is the Academy Division, that is our capacity building arm that hosts the certificate in conflict medicine. And the third division is the Assist Division, and that is home to initiatives such as non-governmental organization initiative, one of our flagship programs. Given the scope of our discussion, I will move into the Academy Division. And basically, the Academy was established in 2017, and it aims to address the critical capacity building needs of global health. And this started by recognizing the capacity building challenges that our region faces, such as conflict settings that lead to security issues that hinder in-person trainings, to the limited context-specific resources and experts, funding constraints, among others. And all of these, not only do they negatively impact population health outcomes, but also they strain national health systems. And so the division goal is to cultivate local leadership and to contextualize knowledge and tools that are used to tackle global health challenges effectively. As such, the Academy has an innovative portfolio to meet these capacity building needs. To start first, we have a variety of capacity building offerings, and these include online self-paced courses, certificates, and diplomas that are hosted on our online learning platform that we call GLAD. So I will be referring to GLAD several times. So GLAD is or stands for the Global Health Learning and Development Platform. Also, the Academy hosts a Center for Research and Education in the Ecology of War, and we refer to it as CREW. One of the main activities of CREW actually is a remote mentored fellowship program that aims to mitigate the knowledge lost within conflict settings by developing the research capacity of healthcare professionals in conflict settings. Our next initiative is the Mobile University of Health that uses blended learning modalities to develop the capacity of vulnerable men and women for them to become community healthcare workers and rebuild their healthcare systems. And finally, not only do we provide all of these initiatives, but we also evaluate them through our evaluation of capacity building program that we call ECAP. Next, I will leave the floor to my colleague Tracy, who's going to give you an overview about the conflict medicine program given its relation to the certificate in conflict medicine. Tracy, the floor is yours.
Thank you, Nasreen, and it's a pleasure to be here. So, like Nasreen mentioned, a lot of the work that we do under the conflict medicine program overlaps with the academy and specifically the certificate in conflict medicine. So I'm going to start by giving you a brief overview of what we do, the work that we do, and if you may say, the rationale behind it. So I would like to start by this slide, which basically shows the many conflicts that our region has been enduring, or the MENA region has been enduring over the past 100 years or so. So if we want to talk about the most recent wars, we can talk about the Lebanon war, the Gaza war, the Syrian war. But before that, we have been also enduring several conflicts, which creates some sort of an ecology of war, as we term it at the conflict medicine program, or a set of consequences that are unique to the fact that in this region, wars do not stop. And so, for example, when we talk about this endemic state of conflict or this constant political unrest, we have the fact that one patient may be injured in one war. So, for example, you can have a patient who was injured in the Great March Return in Gaza who can get injured again in a different war or in the follow-up war that happened recently. And so, this constant state of war, or the fact that these patients are being subject to so many wars in one lifetime span, and having the healthcare system required to respond to these many wars, all of these create a unique set of challenges that are different from the challenges that one might face in a different region, and like in Europe or in an act of violence in the US. And so the idea is that all of these wars create a unique set of challenges that require solutions that are basically contextualized and that are locally driven and that are tailored to the needs of the local population. And so with that in mind, if you can please move to the next slide. With that in mind, the conflict medicine program was established in 2017, co-founded by Dr. Ghassan Abu Sitta, aiming to address the biological, the psychological, and the social consequences of injuries or trauma that results from war. And we mainly operate under three main pillars, if I may say. The first being generating evidence and counteracting data poverty, because we know that in settings of conflict, most of the resources are to a large extent allocated to respond to the immediate needs. And so there's not enough funding that goes to understand the long-term consequences of wars, or how can we better prepare for the next war that will come, as unfortunate as that is. But with that being said, there's a lot of knowledge that is being lost. There's a lot of data that is not being documented in these settings. And so one of the main work of CMP is to document and to generate this evidence to counteract data poverty. So this is one. Two, it's to translate this evidence and research into policy and practice. So once we have the data, the goal of having this data is to actually drive evidence-based recommendations in order to improve patient outcomes or the health outcomes of populations who are affected by conflict. And three, it is to train healthcare professionals in conflict. So basically, we also know that with the ongoing state of conflict, the constant political unrest, there's a lot of brain drain that happens in the region. A lot of surgeons or doctors or physicians or healthcare professionals leave the country, seeking like to practice in more stable settings. And so this again creates a need to train and to allow local people or local healthcare practitioners to gain the necessary skills and the necessary knowledge that would allow them to practice in these settings. And I think this will be like the focus of what we talk about through CCM, but also through the crew fellowship, which Nisreen talked about briefly. So, like I said, these are the main three pillars that we operate under as part of CMP. Next, please. So here is a map that shows like a snapshot of some of the countries that we operated on in the MENA region over the past few years. So we basically work in conflict settings, but also in conflict-affected settings. We've had projects in Lebanon, in Palestine, including Gaza and the West Bank, in Jordan, in Iraq, and in Yemen. Next, please. Okay, so here I'm just going to give you like a little bit of a background information on some of the projects that we worked on and some of the projects that we are currently working on. I will start with the first project that was hosted under CMP, and that is the WAMRU project. And basically, this aimed to understand AMR in conflict settings. So one of the projects that were conducted under this was a study conducted by one of the crew fellows in order to understand or to look at the AMR streams that are coming out of water systems in hospitals. And what the study found was that there's a lot of AMR resistant bacteria in the water that is coming out of the hospitals, which is an issue, of course. And so this is one of the main studies that came out of this project. Another thing that this project aimed to do was to build like a network of professionals that work in AMR and that can collaboratively coordinate or collaborate together on any projects under this theme. So this is one. Next is R4HC, Mina. So R4HC stands for Research for Health in Conflict, and the essence or the basis of this project is to address or to build the capacity, the health capacity, specifically in conflict settings. And so we worked on this project as a consortium between different universities, one of them being King's College, another being Birzeit University in Gaza, and with another also university in Turkey. And we worked on this along three main work streams. The first being the economy work stream, another being the cancer work stream, and the third being the research work stream or the health and research work stream, which resulted in the development of the certificate in conflict medicine. And so a lot of the papers or the documents that were generated under this initiative were able to address or to fill in many gaps that were needed when it comes to the status of cancer in conflict settings in the MENA region, or the economy in terms of the healthcare systems in the MENA region, and most importantly, the certificate in conflict medicine, which Nisreen will talk more about. So another project that we also worked on was the IFIX project. And the main idea or the gist of this project was to actually develop low-cost, locally manufactured external fixators. And we did this in collaboration with Imperial College London. So the idea was that a team of biomedical engineers at Imperial were able to develop fixators that are low cost and that could be manufactured with local material. And so just to give you a little bit of background, the idea is that when it comes to injuries or bone fractures for injured patients, the fixators that are available in a war setting or in Gaza, for example, they are to a large extent usually imported by external organizations. And so many fixators are not actually tailored or their requirements do not meet the needs of local people. And so what we did was that we sent a fellow from the Islamic University of Gaza to shadow the development of the process of development of these fixators, and then brought him back to Gaza to start implementing or to pilot these fixators in Gaza. So we actually started working on this before the war happened, and so after the war we had to stop, but we were trying to understand to what extent this would be feasible to have fixators that are locally manufactured and produced at a very low cost in comparison to the fixators that are available already in Gaza. So this is IFIX. Next would be PROTACT. So PROTACT was also a collaboration with Imperial College, and that through this project we basically worked in or tried to understand different outcomes in through two main wars. The first being the 2006 war in Lebanon, and the second was the 2008 Great March Returns, or most commonly known as Masirat al-Auda. So the aim of PROTACT was to try and understand the clinical burden of these two wars in a population in Lebanon and in a different population in Gaza. And so I will not go into the details of these studies. They are published and available for anyone who is interested in them. But basically, we retrieved data from medical records of different hospitals in Lebanon and in Gaza, and we looked into the most common type of injuries, the mechanism of injuries. We also collected data on the quality of life to understand the burden on participants. We also looked into, we did this in Gaza, we looked into how the team who is responding to the injury affects the outcome. So, for example, having an orthoplastic team versus an orthopedic team versus a multidisciplinary team to respond to the injuries of 4 patients. So we collected all this data, we produced the publications. They are available for anyone who is interested in looking or going deeper into these studies. So this is PROTACT. And lastly, we have iPROTACT. So iPROTACT was kind of a follow-up to PROTACT study, which, like I said, aims to understand the burden of amputations. So we are currently working on iPROTACT with Imperial College London and also with the University of Global Health Equity in Rwanda. The main aim of this is basically to generate data that is specific to conflict or trauma data that is not available in our region. And so the work that we did or that has been already done under iProtect, one of which is a scoping review that aim to identify the available trauma databases that are available in the MENA region. And one of the most interesting findings about the databases, is that most of the data that is present in our MENA region or on data around the populations of the local people, they are not conducted by local clinicians. They are basically being conducted on the military or the army people of, let's say, UK or the US. And most of this data is not accessible to us. So we have like organizations from outside who conduct the data and take the data. So we can't actually access this data in order to understand what are the challenges, what are the outcomes, and how can we improve them. And so this is what this scoping review managed to, if I may say, make clear. And so following up on that, we conducted a key informant interview also under iProtect. So we did several interviews with different stakeholders in order to understand what are the challenges, what are the barriers when it comes to data collection, data management, and data sharing. Also, this will be published soon. Actually, it's not published yet. And so both of these projects culminated in developing something what we call MTAX, or the Minimum Trauma Data Set, which is also another initiative that we're working on under the conflict medicine program. The goal of which is to establish a minimum set of variables that can be used or that should be collected when it comes to conflict settings. Like I said earlier, we have a lot of data that is missing, and this leads to a loss of knowledge. And so it is important to understand what are the variables that need to be collected in a conflict setting in order to better guide future treatments and eventually future interventions. So this is when it comes to the data part of iProtect. The second part we're working on is to understand the burden of injuries, but specifically among children and their caregivers. So in this study, we originally planned to have it implemented in Gaza last year, but after the war, we moved to its implementation in Iraq. So now we are working with the Ministry of Health in Iraq and the American University there to implement it. Basically, what the study is looking to understand is how children who are amputated or who have a lower limb amputation are able to be reintegrated into their societies. So a child who was amputated because of a war injury, what did this have a psychological impact on him? Is he able to participate in his community just like any other child? Were his school years affected? Is he able to contribute to the society as much as any child who is not amputated? And also understand the burden of this on the caregiver, because we know that anyone who is amputated or who has a war-related injury will require their caregivers or the person who is taking care of them to dedicate a lot of time to cater to their needs. And so through this project, we aim to document all the struggles of these people in order to eventually guide better interventions that can help them go back into the society and be able to contribute to it. And so, in a nutshell, this is all from my end. I hope I was able to give you a little bit of background about CMP and our work. If anyone has any questions, please feel free to drop them in the Q&A box. And that's all from my end. Over to you, Nisreen.
Thank you, Tracy. Thank you for your valuable insights. And Thank you for framing the importance of training on conflict medicine with the relevant research that you do in the conflict medicine program. So next week we'll go over an overview about the certificate in conflict medicine, starting over with GLAD. So as I previously mentioned, GLAD is our online learning platform. It basically offers certificates, and diplomas in 3 different sectors. So the first sector is the humanitarian one, and that includes the humanitarian leadership diploma. The second sector is the health and conflict sector, and again, this is where the certificate in conflict medicine is hosted. And the third sector is the civil society sector, and this is where we offer a non-governmental organization management certificate for NGOs. So far, basically, GLAD has over 50 different capacity building offerings, and it has reached over 3,000 registrants from 71 different countries. So moving forward to give more details on the certificate in conflict medicine. So basically, the certificate, or what I will be referring to as CCM, as Certificate in Conflict Medicine. So CCM is an online self-paced certificate that is designed to equip healthcare practitioners with the skills to conduct research and to deliver medical care that is contextualized to the settings of conflict, basically. So the certificate is composed of 4 different courses. And upon the completion of each course, the learner will receive a certificate of completion from a BGHI. And after completing all of the 4 courses, then he or she will receive the full certificate in conflict medicine. Upon the completion of the 4 courses, basically the learner will be able to identify the key theories, concepts, and stakeholders within conflict settings. He or she will be able to describe how conflicts and their ecologies of war impact both individual and population health, develop a theoretical understanding of the different approaches and challenges around medical care provision within these settings, plan and design evidence-based approaches for conducting health research in the setting, and recognize the different landscape and challenges around major health themes in conflict, namely cancer, infectious diseases, and war wounds. So more specifically about the structure itself. So as I said, the Certificate in Conflict Medicine is structured into 4 different courses. Yet 3 of these 4 courses are what we call core courses or required courses. And these include Introduction to Conflict Medicine, Medical Care and Clinical Knowledge in Conflict, and Health Research Methods in Conflict. So these 3 courses, everyone has to take them to complete the certificate. And the 4th course is what we call a specialization course. And this is where a learner can select one of 3 specializations, either war wounds or infectious diseases in conflict or cancer in conflict. So upon the completion of the 4 courses, the learner is going to receive the certificate in conflict medicine. And again, all of these are online, they are self-paced, they are available on GLAD, and this allows for the flexibility and accounts for the flexibility of working professionals, of course. So next we will explore the details of each course, including their main aims and key topics, starting with the core courses. So the first core course is, as I said previously, the Introduction to Conflict Medicine. So basically this course aims to provide a basic conceptual understanding on how conflicts and their ecologies of war impact both individual and population health. And key topics addressed include, for example, causes and trends of conflict, key actors in conflict, and humanitarian action, the different laws and norms that guide them, along with health-related aspects of conflicts, including how we treat marginalized communities, food securities, political economy of health, among others. The second core course is the Medical Care and Clinical Knowledge in Conflict course. And this aims to deliver an in-depth knowledge about the landscapes, needs, and challenges of providing medical care in this setting. Essential topics addressed include the nature and challenges of providing acute and emergency care intervention during conflict. It addresses the role of healthcare staff and the associated interventions that are driven within these contexts, common clinical conditions and diseases encountered by different healthcare providers, the challenges of clinical care for vulnerable populations, specifically women, children, elderly, and persons with disabilities, among others. The third core course is the Health Research and Method course. And basically, this course aims to highlight the complexities of conducting research in conflict, including research organization, access to data, which is essential, data collection, and again, this is a third essential element, and ethics. And the essential topics revolve around, again, the types, challenges, research considerations, and the basic concept of conducting research and their evaluation in the setting, along with the basic qualitative and quantitative research methods to be applied in this setting. So all of these three core courses are required, again, by learners, and they could be registered yet in any sequence, whether individually or as part of the full certificate. Next, we will move to the specialization courses, starting with the first course, that is War Wounds. So the aim of the War Wound course is to provide a detailed understanding or a detailed description of the clinical manifestations and management of war wounds, along with their complications in conflict settings. So this starts with the different classification and mechanisms of wounds, the surgical management of wounds, delayed primary closure, skin grafting, triggers and challenges in the management of neglected wounds, and the factors of affecting wound infection, along with the pathology management, care, and closure of burn injuries. The second specialization course is the infectious diseases in conflict. And basically, this course aims to examine how infectious diseases occur in conflict, and particularly within the MENA region. Some of the topics addressed include the relationship between conflict and infectious diseases, the impact of conflict on antimicrobial resistance, and this is one of the essential topics addressed by key projects under the conflict medicine program that my colleague Tracy just addressed. Also, this addresses the basics of infection control practices and challenges in conflict settings, wound healing and war wound infections, microbiology and key infectious diseases, with a focus on how conflict exacerbates them in the setting. The third specialty course basically is cancer in conflict. And cancer in this course, basically it aims to deliver an overview of the interplay between conflict and cancer control, prevention, care provision, and approaches to address these challenges within a conflict setting. And it addresses research on cancer within conflict settings. So part of the topics that are addressed include the interplay between conflict and cancer, the importance, challenges, and outputs of cancer research in fragile and conflict settings, the basics of cancer research in the setting, the ethical considerations, and how to approach cancer research in conflict. So these are the three specialization courses that learners can choose one from them under their specialty, under the fourth specialty course. And upon completion of each course, again, he or she will receive a certificate of completion. And once all of the four courses are completed, the three core courses and one specialization course, then a certificate in conflict medicine will be issued. As mentioned previously, all of these courses are online and self-paced through our online learning platform that we call GLAD. And basically the course components under GLAD start with a course syllabus, the competencies and learning objectives of the course, an introductory video by the subject matter expert, modules of the course, and then end of course quiz. And I will show you a brief snapshot on how it looks like, basically. So can we move please to the second slide? Yes. So after registering on GLAD uh, and receiving your activation of the activation of your account, you will have access to the course as such. It would look like this. So again, we see the video here. We see the different course components from syllabi, competencies, learning modules that are available. And again, all of these courses were developed by experts in the field. So each course by his or her own respective expert. And then our institution and our e-learning team transformed this course into an online asynchronous or self-paced course to accommodate for the busy schedule of people who would like to register in this. So this brings us to the end of our discussion today. We will be sharing with you an information document just to materialize and to document for your information. This is a link to our QR code. If you can scan it to register as well if you are interested. And I will leave the floor to your questions if you have any. Please feel free to drop them down in the chat box. Thank you. So I have a question regarding the time it requires to complete the course in CCM. So one course on average requires between 25 to 30 hours of completion. But again, given that this is online and self-paced, they basically, it depends on your own schedule. So this is to answer that. We have another question related to the need to take all of the four courses. So as we mentioned, we brushed over this previously. So you can register one course at a time in any sequence. And once you complete all of the four courses, you get the certificate in conflict medicine. But if you register one, you will get the certificate of completion for that particular course. But because we are able to have everything tracked from our back end, we can see your progression. And again, to highlight, these courses are all interactive, meaning we have designed them using the right tools for them to follow an online asynchronous format, whereby we have knowledge checks that are embedded in the sessions. We have activities that are also embedded. It's not that the course is pre-recorded and then you have to register for it. Any other questions? So was this piloted before? Okay, so actually, yes. So the courses, the certificate in conflict medicine was piloted in 3 different medical universities. And it was successfully done. We have a university in Aden, we have the University of Aden in Yemen, we have one in Palestine, and we have one in Iraq as well. Any other questions? Okay, thank you, everybody. Thank you for your time. This brings us to the end of the session. We will be sharing by email all of the details through an information document that you can refer to. Thank you and have a great day.